Be strong.
Hey guys, welcome back to Hope with Jonathan. Tonight we have a very special guest from Albany, Georgia, Mr. Kurt Hooks, who's currently living and battling with kidney disease and kidney failure. He's on peritoneal dialysis, and we're definitely going to bring him on right away, let him tell his personal experience and personal journey with kidney disease and dialysis. And also, we're going to advocate for him, a living kidney donor. Guys, would help me welcome Mr. Kurt Hooks. Welcome to the show, Mr. Kurt Hooks.
Hello, glad to be
How
here.
you doing tonight?
I'm doing fine.
Well,
How
I
about
definitely
yourself?
appreciate you doing. I'm doing well. I'm doing well. I definitely appreciate you coming on and doing the interview with me.
Yes.
Kurt, why don't you tell everybody, your full name and where you're from and a little bit about yourself?
My name is Kurt Hooks. I'm 55. I've been married for almost 25 years. I have a 20-year-old daughter that's going to be graduating next year with a degree in computer engineering. And I've been on dialysis for about 6 months. My condition is getting, once I started on the dialysis, everything it's a lot better than when it was before. And
Yes. You still with us, Mr. Kurt?
yes, I'm still here.
Okay. All right. Well, sometimes we have a little bit of technical difficulties on these interviews. I was just making sure you was with me.
Yes.
So why don't you give us a little bit of your backstory with battling kidney disease? When was you diagnosed with kidney disease?
I was diagnosed with kidney disease in 2016.
Mm-hmm.
I had a situation where I had a colonoscopy done, and
Uh-huh.
after I had the colonoscopy done, it was noted that I had a bacteria infection. So I was given an antibiotic, but at that time, this is something very important for people to hear. If you go to a pharmacist and they tell you to discontinue taking your blood pressure medicine or any type of medicine, check with your doctor first before you
Oh yeah.
discontinue any medication. That was one of my problems. I discontinued taking my blood pressure medicine, and everything
Oh
got out of control. And
yeah.
I had high blood pressure, high cholesterol, and I was a diabetic, so all that played a factor in it too. But
Oh
my
sure.
main thing I want to let people know: don't ever stop taking your prescribed medication without checking with your doctor first.
Oh sure. Oh, most definitely. I would definitely take his advice, guys. controlling your type 2 diabetes and hypertension is definitely huge in kidney disease. Those are the top two factors for kidney disease is, type 2 diabetes and hypertension. And so did you feel like your blood pressure was ever up after you stopped taking the meds?
Tell me you stopped taking it because the pharmacist.
I stopped taking it because the pharmacist told me that I couldn't take my blood pressure medicine and the antibiotics at the same time. And I kept checking my, I started feeling worse and worse. And I was checking my blood pressure and I saw that it was constantly, getting higher. So when I went back to the pharmacist, I got a different pharmacist and she told me that I wasn't supposed to stop taking it. And that was, the start of everything.
Wow. I bet you were highly upset when you heard that you wasn't supposed to stop taking that medicine.
Yes, sir, I was very much so.
Yeah, that probably raised your blood pressure a little bit too, huh?
It did. It did.
Yep. I could only imagine. I would have been highly upset as well. Well, what about any type of family history with kidney disease? Does anybody else in your family suffer with kidney disease?
Well, my mother, she's 78 and she's has diminishing kidney function, right now, but she's not on dialysis or she's not to that point, but she has it. And, that's about it.
Yeah. So you're currently on dialysis. What type of dialysis are you currently doing?
I'm doing PD, which is a home dialysis, and peritoneal, and I've been on it, like I said, ever since August.
Okay. So you're relatively new to the PD and dialysis world.
Yes, sir. Yes, I'm very new to it.
Yep. So I remember when I went on hemodialysis at home, I went on home hemo. I was only on it for a short time, but I remember my first delivery that came to the house. It was overwhelming. I had like 72 boxes show up.
Yes.
Yeah.
Yes, sir.
Yep. And we had to go through a real rigorous, training sessions for about a month. Me and my wife, and we had to follow a lot of guidelines, how to be sterile, and a lot of policies and procedures and rule books, and then we had to make room in the house for all the supplies. Have you had to deal with any of those?
Yes, sir. Well, matter of fact, the good thing about it, my wife works from home and she has an office, in the house, and so part of her office, that's where I keep all my supplies at.
Yeah. And the supplies are kind of heavy, some of them. Like the dialysate boxes that I had 2 in each box, and they were pretty heavy,
Pretty heavy, yes.
Yeah. I was thinking if someone was elderly, they probably wouldn't be able to do it. They would definitely have to have a caretaker, someone to do it for them.
Yes.
Because and when you're on dialysis, sometimes you're not up to par with your normal strength levels. Because I remember coming home from dialysis and being just really, zapped of energy and be really tired, from doing hemodialysis. So I'm sure you can sympathize with all that.
Yes.
Any side effects that you're having from peritoneal dialysis?
None as of now. But when I first started, I was having like a lot of lower abdomen pain, and after they kept changing the amount of solution that was left in the last dwell, they changed my solution to like half of what it normally would be, and then that stopped the whole problem. But other than that, I haven't had any issue with it at all.
Yeah. Well, dialysis is definitely not for the weak of heart. It's a hard life to live, and there's a lot that goes into it. How long do you do treatments at night?
I do treatments 8.5 hours
every night.
every night, 7
7
days a
days a
week.
week. Wow. Wow. What time do you usually like start the process?
Well, I try to get on no later than 11 o'clock so I can get off like 7:30 in the morning.
We start the process about 10.
But we start like the getting my measurements at about 10 o'clock and then setting the machine up.
Yeah. For people out there that are listening and you want to know, what kidney patients go through, you're getting the full experience here. I mean, there's so much that goes into dialysis, and especially when you do it at home, especially the prep time and everything that goes into it, the setup. Then you might have some alarms go off, stuff like that. Do you have any problems with like alarms going off and keeping you up at night?
Oh yes. Yes.
Yeah.
Matter of fact, the other night it went off like 3 times the other night, and I'm talking about getting up
Yeah.
2:30 in the morning, 4:30 in the morning, and then like, it can be, overwhelming sometimes.
Oh, sure. It used to do the same thing with me on hemo here at the house. We would have a lot of problems with different machines. I had 3 different machines when I went on hemodialysis at home, and we had issues just with all kind of different things. And so yeah, I mean, dialysis is definitely not for the weak of heart. It's a tough life to live. And that's one of the reasons why I wanted to bring you on the show to help advocate for a living donor. I want people out there to know what you're going through right now. And why don't you discuss your family? Are you currently married?
Yes, sir, I am. I have a wife. Her name is Cheryl. We've been married almost 25 years. I have a daughter. Her name is Shavandra, and she's 20. She's graduating from.
She's a junior at
She's graduating next year from FAMU University in computer engineering, and I have a little. I call him my little son. I got a little dog. He's a Chihuahua Dachshund mix. He's just like a little son to me. His name is Max.
Okay, that's sweet. That's really nice. We have 2 cats here, and yeah, they're my buddies. So I definitely can sympathize with having pets and all that stuff and the connection. Because when I had my transplant, my one cat that I have, he kind of follows me around the whole house. He didn't leave my side though for like a whole week after I had the transplant. I guess he knew something had happened and he wanted to stick around with me to make sure I was okay. So, but we definitely appreciate our pets, especially when we have a bad day or something like that. You can cuddle up with your pet. They don't bother you too much.
Well, matter of fact, they're just like a ray of sunshine, and when you're feeling bad, they make you, they bring you up.
Oh, for sure, for sure, for sure. So, Kurt, let's talk about where you're currently listed at on the transplant list. So, the information I have right now is that you're. Go ahead.
Okay, I was gonna say I'm currently listed at Emory in Atlanta, Georgia, and Mayo in Jacksonville, Florida, and currently trying to get on the UAB list, Birmingham, Alabama.
Okay. And guys, the information is kind of ticking on the banner down below, as you can see, and it's scrolling there if you're interested in any information at all. Kurt Hooks is his name. You'll mention his name if you call that number that's on the screen below. Also, Kurt has a Facebook page. Find Kurt a living donor kidney, and it's on Facebook. And there's the phone number. Like you said, he was listed in Emory in Atlanta, Georgia, and it's Mayo in Jacksonville, Florida, right? Yeah. Okay.
Yes, sir.
Okay. And also, we want to bring up the possibility of paired exchange. Your blood type is your your blood type B positive.
B positive.
Okay. And those hospitals they definitely utilize the
Yes,
paired
sir.
exchange program. Okay. Okay. All right. So we definitely wanted to, bring that up. The paired exchange program helps with patients that have a donor but may not be compatible with their blood type, and they go ahead and donate their kidney, and then they swap it out for another kidney, and the potential donor ends up donating their kidney, and then by swapping out with another kidney, then Kurt
Yes.
would be able to get a
So
kidney
both of
as
them.
well. Yeah. So Kurt, why don't you tell everybody what you do for a living? Kurt, can you hear me? Can you hear me, Kurt? I think we're experiencing a little bit of technical difficulties on my end. Kurt, can you hear me? So guys, I appreciate you tuning in. Kurt, I don't know if you can hear me or not.
Well, I've been disabled since 2009, but before that, I worked for Cooper Tire and Rubber Company for like 16 years. And
Okay.
Textiles, which is a manufacturer of cloth, I worked there for 11 years.
Okay. Okay. And what would
Yes, sir, I
receiving
can.
a okay. What would be receiving a kidney transplant? What would that do for you and your family?
Yes, sir. Okay. Do you hear me?
Yes, sir.
Yes, sir.
Kurt, if you can hear me, I was asking you what a kidney transplant would do for you and your family.
Yes, I can hear you.
Okay. What would a kidney transplant do for you and your family? Kurt, can you hear me? Guys, we're having some technical difficulties on their side. I'm having a little bit of issues with getting through. I don't know if there's some internet connection issue or what. There's a really bad delay. Unfortunately, I want to let you guys know that Kurt Hooks is currently listed at Emory Hospital in Atlanta, Georgia. He's also at Mayo in Jacksonville, Florida. Also, he's got a kidney page called Find Kurt a Living Donor Kidney. You can look up any information there. You can contact them through that page. Again, guys, Kurt Hooks from Albany, Georgia. Okay, guys. I really appreciate him taking the time to do the interview tonight. We've had some technical difficulties with the internet. Let me see if I can get him back on.
You know,
Hey,
getting
Kurt.
donations going out, telling people about,
So,
donating, kidneys, and it would be life changing for
oh,
me.
okay. Yeah, for
It'd
sure. I mean,
be life changing.
Yeah, a kidney transplant would be totally life changing, and definitely would change Kurt's life. Guys, you've heard his story, and you know the information. We've given you the information. Find Kurt a living donor kidney. You can call 1-229-349-4810-01, and that's the Emory Hospital in Atlanta. And guys, you can definitely check out his Facebook page to get more information. I really appreciate Kurt coming on, telling his personal story. And hey, Kurt, I really appreciate you coming on.
Yeah, I can hear you.
Unfortunately, guys, we've had some technical difficulties tonight, and I'm basically apologize for that. But again, guys, Kurt Hooks, I appreciate him at the beginning. He was able to share, some of his story. We've had some technical difficulties, and I apologize for that. For whatever reason, this is a internet problem. Sometimes it happens. I definitely apologize. I'm going to have to bring him on again to do another interview. But guys, he's got a Facebook page that you can definitely go check out his information. Find Kurt a living donor kidney. You can call 1-229-349-4801. And that's Emory, Atlanta, Georgia. And then he's also listed at Mayo in Jacksonville, Florida. He's blood type B, and we've already talked about and discussed about the Parrot Exchange program. Hey, Kurt. We started having a little bit of technical difficulties.
See if he
Can you hear me?
You hear me, Jonathan?
I can hear you. I can hear you. I can hear you. Yeah, we've got a slight delay or some internet issues.
I'm gonna type in it.
Okay.
Yeah, we had some technical difficulties.
Trying to be technician.
I had one last question, and you tried answering it, but we didn't get it out there really. Is what would a kidney transplant do for you and your family?
Yeah.
Oh, okay.
Guys, he's experienced some technical difficulties. I'm not sure what's going on with the internet. We're having some issues with connectivity, not able to
A
really
kidney
complete the.
transplant will be a life-changing event for me. It will give me the opportunity to be a spokesman for, say, for like kidney transplants, and it would give me the opportunity to tell my story from beginning to end, from the first stage of being diagnosed to the stage of receiving the kidney transplant. And I think that, it would give me an opportunity to let everybody know there's nothing wrong with donating a kidney. It's something that can change a person's life, not only my life, but it enhance my family life.
For sure, for sure. And that's the reason why we wanted to do the interview, was to get your story out there and let people hear, what you're experiencing, what you're going through as a kidney patient and waiting on a transplant. So that's one of the reasons why we wanted to bring you on and let you share your journey. Guys, again, unfortunately, we're not going to be able to complete the interview tonight. I want you guys to know I really appreciate you guys tuning in, and we'll try this again. We'll do this interview again. This happens sometimes with technical difficulties, the internet for some reason, or whatever the problem is. But guys, again, you can find information on Mr. Kurt Hooks of Albany, Georgia. Facebook, find Kurt a living donor kidney. It's a page on Facebook. You can look it up. You can also call his transplant coordinator 1-229 349 4810 Emory, Atlanta, Georgia. And he's also listed at Mayo, Jacksonville, Florida. Blood type is B positive, but we've already talked about the paired exchange program. Listen, guys, I really appreciate you tuning in to this Hope with Jonathan episode. Hopefully we can get Kurt to come back sometime and do the interview again. We've got some, issues with sound, technical difficulties, and I definitely apologize. But guys, again, I really appreciate everybody. You guys take care, stay blessed, and get your kidneys checked out.